Hello. Welcome again to another episode of Under the White Coat. As you know, at Under the White Coat, we interview colleague physicians. We try to get to know a little bit about themselves and what they've been up to professionally and learn a little bit along the way. Today, I'm actually very excited to be interviewing Dr. Smita Halder. She's a friend, colleague, and a mentor of mine in Hamilton. She's the chair of the MAC. We'll learn a little bit more about that. She also leads the CAG Women in GI Mentorship program. She also has developed a physician executive coaching training program. We'll learn a little bit more. And so I would like to welcome Smita.
Thank you very much, Sam. Thank you. It's a lovely intro.
Great. Thanks so much for joining us. You know, if you've watched these podcasts before, we try to keep it very light and get to know a little about yourself. And so, you know, typically I like to start off just getting to know a little bit more about you. You know, I know you personally and professionally, but just so then everyone else can hear a little bit more, why don't you tell us a little bit about yourself and sort of the story of how you got to where you are?
Great. Okay. Yeah, so you can probably tell I'm not Canadian. I'm from Manchester in the UK, and I studied medicine throughout just in the UK. I did all of my med school and residency training there. And then in 2008, I came over to Toronto to pursue an IBD fellowship at Mount Sinai Hospital with Mark Silverberg and Hilary Steinhardt. And I was there for 2 years, and then came on to faculty at McMaster in 2010 July, which is probably when I met you for the first time as one of my residents. So I've been there 10 years now, and I'm now an associate professor in the department. And it's been a really exciting 10 years, a lot of changes, and it's been a very interesting journey.
Unbelievable. Time completely flies. 2010.
Yeah.
And yeah, unreal. So, you know, one thing I started off when in your introduction was that you're the chair of the MAC. Now, I know about the MAC only just more recently being involved personally at my hospital, but maybe explain a little bit what that means, because I know that's a huge role.
Yeah, so that's something that I had looked into about 18 months ago when the position was coming up, and leadership has been something I've been very interested in for about 6 or 7 years. I did a couple of leadership courses, and the MAC position, I've got to admit, I didn't really entirely know what the MAC chair did until the position came up, and I was, discussing it with various members of the executive team and the chair that at that time. And it really it made me realize, like, it's such an all-encompassing role, because it's sort of in charge of making sure that the work life of every physician that's in Hamilton Health Sciences is it's fair, and it's all the interests of the physicians are being definitely top of mind, and the fact that we should be delivering good quality healthcare as well is really important. So I'm involved with the credentials committee, the death review, various other subcommittees that are involved, that are ensuring that we actually do carry out the work that we're taken on to do, but at the same time making sure that our interests are always heard. So it was, I didn't know much about it going in, but it's been an incredible learning curve for the last 18 months. And I think with the pandemic as well, it's been so interesting being at these high-level discussions with the executive team. I mean, at the beginning, we were on daily command center calls, and to be in on those calls, hearing the chief exec talk about how we're going to have to totally change our way of doing medicine was a huge learning experience. So yeah, so that's kind of what's taken up most of my non-clinical work time for the last 18 months. So yeah, so that's one of the things. I'm on the board of Hamilton Health Sciences as well. So that's something that, again, I've never been on a board before. And you get to meet these incredible the directors who've got such varying, experiences in business and finance, and just seeing how they really question, in great detail what we do as a hospital, which I think as a physician, we don't really appreciate how much goes into running it. It's a corporation. I mean, it's like any other business. So that's been very exciting as well to get involved with.
I totally agree. I've become involved myself at my hospital, and at different levels of from the capital committee to the MSA and the MAC. I think as physicians, we don't see some of that back end part, but I think it's very, very, very important work. I think one other thing is it's very important to have that physician voice in that room, because I think it adds a lot of color. So I think both sides sort of benefit from that. One thing that really impresses me, Smita, is medicine, even still today, I think is very much a male dominated profession, especially in the administration side. So it's always impressed me that you're able to pick up those roles and really do amazing things with them. And one thing I wanted to talk about was the Women in GI Mentorship Program. So maybe talk a little bit about that, and maybe also touch on what challenges you have felt as feeling that as a woman in medicine and a woman in administration, have you faced any challenges on that end, and and what advice do you give your colleagues?
Okay, yeah, I'm very happy to talk about this mentorship program. So I'm a co-chair with Dr. Laura Hartz, who's a GI pediatrician, and so the two of us, we kind of started talking about it about 2 years ago, and it was as a result of coming away from conferences where a lot of the key opinion leaders and just the panels, or the manels as we call them, were almost 100% male GIs. And I think there was one conference where I was so disillusioned when I came away, because even the talk on pregnancy and IBD, which I knew the field with all the other researchers across the country, and we're mainly female researchers, and none of us had been asked to deliver that talk. And so we came away with the idea to just set up a program of mentorship, because gastroenterologists, we are predominantly it's a male dominated specialty, much like cardiology and some of the surgical specialties, and about a third of the gastroenterologists, according to CAG, are female, but we're not really seeing them in the high level positions like program director positions or division director jobs. And so one of the things that I think we struggle with is that because we're not seeing ourselves in those positions, maybe we're not always going for them or being asked to go for them. And so the mentorship program, it's a way of linking up sort of mid-career and sort of senior female gastroenterologists in research, in clinical work, and administration, but they all have to have some affiliation with the CAG. They're linked with a mentee, and it's like a matching process. So we had our first, I think it was launched about 2 years ago in the fall, and we matched 40 pairs of mentees and mentors, and it's up to them how they meet. Some of them are across the country, so they were already just meeting by virtual meetings, but we've had great feedback, and it's open year on year so that we can get the new residents through and the new medical students that are interested in gastroenterology so that we can help them. And it's really helpful if you actually don't have somebody that's in your own faculty or your own department as your mentor, because I think it's good to get that objective voice and that the perspective of how things might be. And so we've had great feedback from all the participants, and we try and meet at CDDW and have a sort of meet and greet, and to get to actually some of us get to see our mentee. Like I have a mentee in Calgary. I actually only have met her twice, and I was fortunate to meet her again in Montreal before lockdown happened in the spring. So that's been one of the programs I'm very, very proud of being involved with. In terms of my personal journey to these positions, I mean, I think I've had amazing mentorship myself, and it's like having that person that opens the door for you or just taps you on the shoulder, that he for she concept. And for me at Mac, it's been Dr. Barry Lum who sort of came up to me about the MAC position and said, go and just chat to the incumbent and see what the job's about. And then just having more and more of these people just open doors, and it's just creating opportunities, for people. So I have been incredibly fortunate that way. Same way in my training, I had a professor in Manchester, and I was really a first year resident. I just joined on the residency program. And our programs are 5 years long. I was interested in research. I'd not really done a master's. I'd gone to medical school from high school, as we all do in Europe. But Professor Thompson, was very instrumental in just sort of saying, there's a new master's program in research coming up. Why don't you enroll in it? That was research methodology. Then that got me interested in pursuing a PhD. And then he knew somebody who he'd worked with at the Mayo Clinic, go and give you a talk at the Mayo. So it's all these things where at the time when you look back, you don't realize the absolute impact of just picking up the phone. I mean, this was early 2000s when I think I wrote an email to the professor at Mayo Clinic. And the next thing was we were working on a grant together, and I was able to spend a year at Mayo. I mean, that's just such unbelievable luck and just grasping an opportunity when it was available as well. So yeah, so I think those are the things I would say about what's helped on my journey to where I am at the moment.
That's a great story. I think the small kindnesses that we can do for each other and our colleagues, I think they go a long way. And sometimes the small things that, just little introductions here and there that some people might not appreciate, that it's not difficult for us to do, but have long lasting impact down the road. Have you noticed any changes, let's say in the past year or so, in terms of opportunities that are becoming available for female physicians?
Yes, I think so. I mean, I think that there's so much more awareness that there are women there who, because maybe they've had maternity leaves, or that their career trajectory hasn't followed or mapped out maybe their male friend from residency, where you've not needed to maybe take as much time off and things like that. And I think that the awareness is there now that we are able to take on these positions and carry them out with as much competence as our male colleagues. It's just that the timings are just different, and in my again, just going back to my personal journey, I had 2 different mat leaves of 5 months for my first child, and then a year for my second. And that undoubtedly pushes you back, not just those 5 months or a year, it pushes you back even more, because you take time to get back into the swing of things when you go back. And I think one thing that I've noticed with some of my female colleagues, and I'm absolutely in the same boat, is that when we go for a position, we only go for things sometimes when we think we're 100% ready to do that. And what I'm learning from talking to my husband, for example, he would apply for things when he might have been 75% of the way there, but he had confidence in himself, and he would just jump in and get those, promotions and positions. And so I think that what we're doing now is trying to work. I'm part of a huge, sort of peer group of female leaders across Canada, where we're trying to promote that way of thinking, that let's just really just jump in, take the opportunities, promote ourselves better. We're not historically as good at promoting ourselves. And so I'm seeing a lot more of these leadership groups and Facebook groups where we're just really, trying to bring more people up to the surface and get them noticed. Yeah, so I think there's more opportunities out there, and you are seeing a lot more female heads of service. I mean, when I'm on the credentials committee, I'm seeing who's coming up, who are the new heads, and it's reflecting what we're seeing in medical school a lot more, where half of us are female.
That's great. I think it's time for us to rebalance things. I think just like I like that term, the mantle for the male panel. I haven't heard that before, but I completely understand what you're talking about, sitting at
Most
those.
of your female colleagues will know what that is.
Right. I haven't heard that before, but yeah, no, I completely appreciate it. You're at a conference and it's just, completely dominated. No, it's great. And I think that leads us right into the other thing I wanted to discuss was the physician executive coaching that you started to do. Why don't you tell us a little about that, how it works, and what you're offering?
Okay, yeah, absolutely. So I mentioned I'd been on a couple of leadership courses. I did one in Kingston, which is the Smith Business School executive leadership course, and the other one was in HHS, actually, in the hospital system. Both times we had our own coach throughout the course, and we had sessions with the coach, and they could you could bring anything to them, any issue with our teams or mentees or mentors or whatever, and we could work through it. And I was just amazed at these, this kind of this system of having a coach. It was totally alien to me. But in the business world, and as you're probably very aware, it's incredibly common for people, especially leaders, managers, to have a coach, and they guide them through difficult decision making and conversations. So actually, one of the things that really interested me finishing the leadership course was learning more about how do you become one, because a lot of the skills we have as physicians to be able to relate to our patients and take good histories and things, and the listening skills we have are really important in coaching. And it's totally different to counseling. You're not a therapist. You're literally just pulling out the tools that person has that's sitting in front of you to give them the confidence and the skills to really be a better version of themselves. So there aren't many physician coaches. I researched it, and really there's a handful in Toronto and across Canada. So I looked into a course called it's run by the Physician Coaching Institute it's based out of Washington State in the States. And I signed up for that. And so from March to September, I was enrolled as one of their cohorts. And so now I'm certified it's called a physician development coach. And I'm going to set up my own sort of, I guess it would be like a side business as a coach. I'm going to offer my services to the university, to Hamilton Health Sciences, and then also just privately as well. And so it's really, physicians are we're under such huge pressures anyway, but now with the pandemic, it's incredibly hard, and there's a lot of burnout and a lot of issues, financial issues that some physicians are experiencing. And I think now more than ever, I think we're going to see a need for coaches to really just help us get through this totally uncharted territory. So yeah, that's something that I've just launched in the last 2 months.
That's an incredible initiative. I'm very excited to hear more about that. I would love some coaching myself. I think you've informally mentored me over the years, but it would be great. Yeah, that's terrific. Do you have one of your top pieces of advice, maybe just one of what you would tell possibly one of your mentees or that you're coaching?
I would say that in medicine, I think we are programmed to think that all we can ever do is do medicine and be a clinician. And I think that if you keep your eyes open and your ears open, there are so many other opportunities where the skills you have are transferable. And I think that that's been my biggest learning in the last 2 or 3 years. We probably always thought that all we can do is, and it's a very sort of, limited area of a job. I mean, we can really use our skills in so many different lines of work. So I'm not saying that, you should think that you'd have a different career, but just be open to, and you're an example of this, Sam. You've taken on such an entrepreneurial, kind of paths in your life. And I think this is how we're going to keep our excitement and our, motivation going in medicine, by having these other interests. And so just be open-minded about it. And I think that's what the biggest piece of advice I think I would have given myself, because I just boxed myself in too much from an early part of my career.
I think that's an incredible piece of advice. I don't think Frances has ever heard this before, but she really changed some of the trajectory of my life. Where I had a meeting with her when I was a GI fellow, and she was saying, jobs are very scarce out there. You need something a bit more interesting than just your clinical. What's something else that's really interesting to you? And hence, I did my MBA at Rotman and through the clinician investigator program, and a lot of people that supported me along the way and getting me to where I am today. But I think that's incredible advice. I just happened to have someone that guided me at the time, but I think a lot more physicians, young physicians, even any time in their career, would definitely appreciate some of that coaching and advice. That's a great initiative. So we'll keep in touch with that. I would love to connect you to a lot of people. I have a lot of people that do reach out to me as well, sort of informally, to help guide them, and what are other things that they can do with some of their clinical knowledge outside of the day-to-day hospital work. Yeah, right, that's exactly. Amazing.
Yeah, and you know what? The other thing is that I didn't realize how valued our skills are by non-physicians. When I walk into that boardroom, I was totally in awe of CEOs of finance companies and energy companies, and somebody turned to me and said, "No, you're the one that we're all in awe of, because you're the doctor around the table." And I honestly, that blew me away, because I never really thought of things like that. I always I think we're all, maybe it's just our nature that we think, oh wow, somebody's a CEO, but really they're very respectful of what we bring to the table. So we shouldn't undervalue ourselves.
That's great. That's a great insight. I've taken up a lot of your time, but I wanted, every time we finish up one of the podcasts, we try to get to know a little bit more personally. I also want to just make the caveat, we could have spent an hour just discussing IBD and GI, your research, your interest. And, for other listeners, before we clicked the record, I was already picking Smita's brain about some cases. So we could have spent ages, but one thing I really want to touch on Smita, because she's such a true physician leader and a great representative for other female physicians. So we really wanted to focus the podcast today on that. But, I wanted to end on something we're quickly chatting about is Voices Rock Medicine. And I was watching the YouTube video. It was very impressive.
Oh, you watched it? Good.
I did, of course I did. Yeah, kids were asleep. I had to listen very, very quietly, but no, it was great. So maybe tell us a little bit about that. And one thing I found, a lot of it was you could see it was on Zoom, so I'm sure COVID has really affected that. So maybe tell us a little bit about Voices Rock Medicine, and also how the pandemic has sort of affected practicing.
Yeah, of course. So Voices Rock Medicine is a female physician choir. It's based in Toronto. They were meeting in Leaside before the pandemic, and then in March everything went virtually. And they released a video, actually, just to it was done in March. This was the first of their videos, which was a version of a Leon Dubinsky song called Rise Again. But I've joined since this summer, because I was watching my friends in it and thinking, gosh, this is, I haven't sung since I was in high school. So, what could go wrong? And you didn't have to audition. That was the other thing I was really happy about. But anyway, I'm having the best fun ever. And so, we meet on a Monday. There's 54 of us, and we belt out those tunes. And I think it's helping. We did that version of Brave, and it was released at the OMA Gala, at the Foundation Gala, just a couple of weeks ago. And I think we got great feedback. So it's something that we all meet, and we come away with such a feeling of, this is really our time to decompress and a bit of self-care time. And it's really helped, our kind of mental health during this time, for sure. So, yeah.
Yeah, no, that's great. I'm not going to put you on the spot and ask you to sing a little ditty, but but it was great. The video was great, and I'll attach the link so people can watch it as well to any posts that we put up for this podcast.
Oh, that'd be great. Thank you. Yeah.
Great. So I know, Smita, I know I blew a little bit over our time, but
Well, that's
honestly,
okay.
we can go on for another hour.
Well,
Uh,
I want to say I owe you a name. I owe you my son's name. So I don't mind going over, because if it wasn't for that conversation I think we had just before I was about to give birth to Sam, um, I think his name may have been something different. So yeah, so it turned out that I was due on your birthday. So that was it was very serendipitous.
Yeah, no, that was great. I'll never forget that. And I love my name. My name's after my grandfather. It's sort of an old name that I think is staying in style these days.
Oh,
So
exactly.
and there's not too many. My son is Ethan, and there's 17 Ethans in his class. So we
Yes.
regret that name.
Yeah,
But
you're right. He's the only Sam. He's the only
yeah.
Sam for a while.
Well, thanks again, Samita. Of course,
My pleasure.
We're going to touch base again. But I really appreciate you taking the time, and stay tuned, and hopefully you'll see our next episode of Under the White Coat.